Well, hello, it's Angelo Caruso here with another Talk to Me podcast. We have a very special guest today. It's Sarah Markiewicz. Hi, Sarah.
Hi, nice to meet you.
Nice to meet you too. We've spent some intimate time on the phone because you read a very important document, actually translated it for me.
Mhm.
You, uh, I guess you looked after was it a CBC, complete blood count, or something more elaborate than that?
Well, we went through we did go through a CBC, but also a hormone panel. And so we kind of went through a whole package to kind of put some pieces together and
Yeah,
see where everything stood and went through them for you.
Yeah, and I call it an intimate session because you were telling me things about myself that most people don't talk to me about. And also, you were telling me surprising information. And I was so surprised at what I learned about my own health that I thought
Mhm.
it might be helpful for us to have a podcast session to talk about this in detail with myself as the guinea pig here, so that other people could be inspired to get the same type of test done for themselves and maybe improve their health situation. I mention this because I thought I was in pretty good shape, and I was actually shocked at how low I was in some of these levels. So we're going to go through that in just a second. For anybody
Okay.
that's watching or listening right now, if you're watching, you can, of course, listen to any of my Talk to Me podcast episodes on major platforms like iTunes and Podbean. And if you're listening, you can watch the video on YouTube, on the Angelo Caruso YouTube channel. Sarah, tell us a little bit about your background. I know that you're working in several places, but primarily my relationship is with you through Proactive IV, which is an IV lounge here in Rochester, Michigan. Where did you go to school?
I actually started at Michigan State. I was a registered dietitian
Yep.
and loved what I did and wanted to continue on in medicine. So went down to Nova Southeastern University in Florida and developed my career as a PA, a physician assistant, which is now going to become physician associate,
Oh,
and started to get into hormones and helping patients, and led us to us meeting.
help us with the org chart. Is a physician's associate a higher plane on the evolutionary scale?
It is, we are trained in the medical model and we see patients just like a physician does, but we are still linked to a physician. So we're able to spend more time with patients, be able to really explain things and give them the time that they need. Where a lot of the times, you're just logged into a 15-minute time slot. So we get the opportunity to be able to explain and really help patients out.
They should have given you a different set of initials instead of duplicating PA. Is it still called PA?
It's yes, yes.
Physician's
It's
associate versus
PA,
physician's.
physician, yes, physician assistant, in the process of changing to physician associate.
Yeah, I'm going to get you a new set of initials, that's for sure. All right, so one other little point of reference here, because a lot of my listeners know of the redhead. Renee Pathidis, my wife, works as ops manager for Proactive IV, full disclosure, and she has been after me some time to get my hormones tested, and I've been getting a blood test regularly through physicals. That's pretty common. But the hormone testing is a fairly new development in the history of medicine.
Mhm.
You and I were talking about this briefly, that this used to be a very dicey place. I mean, HRT, or hormone replacement therapy, was almost like voodoo in the early days.
It has really circled around a handful of times. So actually, it started around 1930s, 1940s,
Oh, wow.
and yeah, so it has been around for a little while. Now, in medicine, that's still kind of short term. And it started to get the ball rolling. And in the 60s and 70s, birth control pills came out. And so that really started opening the floodgates. But then there was another turning point around 2000 when they had the women's health study. And that really dove deep into what we were really working with and working around. And that's kind of where I think a lot of talk in places in media, you started to see hormones. But then we've kind of come full circle again, and only really in the past maybe 5 or 10 years have we really started to balance everything out and really get the information out there.
And like in most cases, the science is progressing a lot faster than legislation is. So we want to encourage people right at the outset here that while this is an information-based program, we are not giving you medical advice. You should check with your doctor. You should do all these things, with your team of experts and make the decisions that are best for you and your family. I will endorse this because it's working for me. And like I said, I was very surprised at not only my baseline, but what was possible. And one of the things that became clear to me early on was that all of these tests come in with a range, like a normally acceptable range. But here's an interesting way to look at range, everybody. The average person is overweight. So what does that do to, I don't know if that's changed, like if the average person that's 5'9" is supposed to weigh 165 pounds, but over time, everybody weighs 185, do they change the average weight over time? Is it happening
Well,
that way?
the that change is not necessarily happening. So when you talk about average and you talk about medicine, we're talking about two different definitions, even though they do sound the same. So
Okay.
the average is just your patient, population that you're looking at, but what the recommendation is still staying the same.
Okay.
Mhm.
And then on a finer point, the range, which is the low level and the high level, you're supposed to be in that range with whatever test we're going to be talking about here in a few minutes. And we're going to go through the most significant ones that I took in detail so people can understand that just being in the range may not be optimal. And that was a
Correct.
big aha for me because let's talk about something like testosterone, which is something that men um, uh, can talk about quite easily because it impacts so much of their lives, everything from desire to the spring in your step, and this feeling that you can get through the day, like feeling your old self again. Whereas if you're deficient in something like vitamin D, it just kind of sneaks up on you. You can't really talk about, I couldn't really talk about being low in vitamin D. I didn't even know I was, but I knew that my age was creeping up, and I knew from an academic point of view that we stop producing hormones as we get older, correct?
It definitely starts to slow down, and we see a decrease in the levels, as time goes
That's what I meant. We
on.
didn't stop
Yes.
producing them, but we don't produce as many. Yeah.
Correct, correct.
Okay.
Yes, and it's interesting that you mentioned age too, because that's one of the biggest factors on why it sneaks up on people. So a lot of us like to use, we don't feel the same. We're not able to get as much accomplished as we used to, or we feel like we're pulling ourselves through daily life.
Yeah.
But we use age as a reason for not doing what we want to do.
Yeah.
And so that's one big piece that I like to talk about with patients is that if there's a reason why, if you're feeling different, then we want to help you find that reason. But the
Yeah.
reason isn't always going to be age. We can definitely get you to feeling where you want to be, no matter what age.
I love it.
Yeah.
And before we actually dig into the tests, I mean, another practical example, a person who's aging, I'm 65 years old now. A person 65, 70, 72 years old might say, well, uh, I'm really falling behind in technology. I'm not nearly as sharp with tech as I used to be. But it turns out some of the hormones are directly related to cognitive decline. True or
True,
false?
true, true. They can
So if
be.
that
Yes.
doesn't get you interested in checking this out because you're cognitively slipping just because you're not paying
Mhm,
attention to this.
mhm.
So let's go through the test and then we'll talk about things like pricing and barriers to market and barriers to entry for people that maybe haven't been involved with HRT before. Can we dig into the test?
Sure, absolutely,
Let's
absolutely.
do it.
Since you mentioned the vitamin D, we can start there for
Let's do it
sure.
because it's a nice sunny day outside, and I'm going to try to get outside. Most
Mhm,
people know that the legitimate form of vitamin D comes from the sunshine, but I live in Michigan where we have winter for about 40 days. Sorry,
mhm.
summer for about 40 days. Uh, and somebody told me one time you could get vitamin D from a certain kind of mushroom. Is that true?
There are definitely different ways that you can get vitamin D with mushrooms being one of the ways. Sunlight is the one that everyone thinks of, that helps your body, convert what we need. But ultimately, most people are still low,
Yes.
whether, deficient is below the range, but low can still mean, the low end of the range, which gets us back to that optimization that I believe you were talking about earlier. But looking at your levels, we have a range for vitamin D,
Yes.
that's 30 to 100, and your level came in at 29.
Which
So
blew
you
my
were
mind. Blew
on the
my
low
mind.
side.
I've been saying I'm outside exercising. I exercise every single day. I'm outside.
Mhm,
I got tested during the summer, and I
mhm.
still botched
Yes,
the results. Please continue.
yes. That's all right. So with low vitamin D, that's one of those things that we don't, necessarily think about on a daily basis, but it can lead to not getting as good a quality of sleep, not feeling like you've got that motivation and that drive, kind of feeling a little more tired, fatigued, sluggish. A lot of the symptoms that we tend to push off, or once again, kind of blame age for. But this is, one example that, we can highlight for our listeners and say that there may be something that we can help with in regards to making sure all your levels are optimized and getting you back to feeling the way you want to.
Little spoiler alert here as we run through the tests, everybody. I'm acting on everything that Sarah advised me on. So I'm now on a D supplement, and we're going to get tested again. I think it was a 60-day differential from the first to the second test.
In general, yes. Yeah,
So
for the
I'm
part for being a
about
test.
3 or 4 weeks in, and then I fully expect, having followed the instructions, that my D will be elevated. So uh, we won't cover this with every version of the
Mhm.
test, but for every time I was suboptimal or sub range, uh, I'm taking action. And maybe we'll do another podcast episode later to talk more. Please continue. What else did we learn
Sure.
when I took the test?
So we also checked your hemoglobin A1C. That is a pre-screening that most offices use for diabetes. Basically, what that hemoglobin A1C is it's an average of how your blood sugar level is running over a 3-month time span.
Yeah.
So it's not an in the moment level, which most people will say they monitor their sugar levels. This is an overall 3-month average that you've been running. And your level was at 5.1, and we like to see that below 5.7. So that was good. You were
Okay.
doing well on that.
Thank you.
Yes. And then going through some of the other labs, and these kind of give us the whole picture for patients in regards to making sure everything's in place when we're talking about hormones and hormone therapy. We look at your blood cell levels, we look at your red blood cell line and your white blood cell line. All of those were looking pretty good. We had one level that was a little bit on the higher side that we're going to monitor, and that can sometimes be with folic acid in B12. And so that's something that we're going to keep an eye on as well. Since that level, which was an MCV, we want to check vitamin B12, and we did do that for you. And that range is 180 to 810, and your level came back at 316. So that was in the bottom half of the range. So that was something that we were looking at as well for you.
And we took interest in that because that's linked to also energy and serotonin release.
Yes, it is a building block for a lot of different processes in the body. Mainly the ones that patients have trouble with are fatigue, low energy, also kind of like different pins and needles or muscle cramps, a lot of the functioning of the nerves it helps with. We did say energy level as well. Also thought process, and also serotonin levels. So it really is a cognitive portion, an overall well-being, energy. It's really a building block for a lot of different things in the body.
Give us the quick definition of serotonin again. Why is that so useful?
That is one of what we call neurotransmitters, or essentially hormones that help our nerves and our brain function. And that is really important for how we feel in the mood that we're in.
So, quick summary, everybody. If I want my brain to function better, I want to get my B12, is it?
Yes.
I want to get my B12 elevated. if I want to pass on my brain functioning, I can lay low on the B12. So you see how this became easy math for me. Very good, Sarah. Let's continue.
Okay. And then going through, we also look at what we measures a PSA screening of prostate-specific antigen.
Yes.
We look at that because that is a level that most males have checked, especially over the age of 40. And that we make sure is in range. We want to make sure before, if someone is interested in starting testosterone, that we get a baseline for.
Yeah. And thankfully, my PSA was well within range. A fun fact, everybody: the prostate is the only gland in the human body that grows larger as we age. And this is the one, of course, that nobody ever wants to go in and get checked because it used to be checked digitally, which was very uncomfortable for everybody, including some of the doctors, I think. And now it's an easy blood test. Yeah.
Yes, for the most part, they use it more of a screening test now. And then if it is borderline or elevated, then they still go and revert back to some of the other basic tests from
Very
before.
good. Well, I was really glad to get good news on that because that's just one of those things we're always watching. Encouraging all men over 40 to get their PSA checked on a regular basis. This is the easiest form of cancer to detect and the easiest form to prevent, but you have to stay in front of it. Can't talk about this enough. Thank you, Sarah. What else?
You're welcome. You're welcome. One of the other big players for us, because it really relates to fatigue and tiredness, also as we age, is our iron levels. And your iron and what we also call ferritin as well, we check both of them. Those are both looking good for you. So that was good news. The iron level is what's circulating in our bloodstream. And it's really important to check that ferritin level because that's what our body has stored up. And if you can think about if you're running low on something, say for instance, you're in the kitchen and you're making dinner, you're running low, you can go to your pantry and you can bring out whatever you need and you've got more of it. Our body has what we call equilibrium. It's always trying to make sure it has what it needs. So if we don't have enough iron to use and it's in the bloodstream, we're going to take from our stores, which is in the tissue, and dump it into the bloodstream so that we have enough. So if someone is low in their stores, your body is going to have to start compensating. And that's a slow process as well. But that also is a stressor on the body that also leads to and can lead to weight gain, tiredness, fatigue, and that ball that we all pretty much fight on a daily basis. And so this is one of those big pieces as well that we check and look at when we're doing hormone studies on patients.
Nice. I have a friend who's been getting chronically low iron reports from his doc.
Mm-hmm.
And the simple diagnosis from the doc, or not prognosis, prescription, was to eat more spinach. But there's an issue with this if you're not absorbing your food.
Correct.
Absorption has to be happening in order for the spinach to do its thing. And you were about to say something about absorption.
Oh, no, that's okay. So there's a couple of different things. We want to make sure that your body is able to use what it has, and we want to make sure that it is absorbing what it needs in order to have that. So we want to make sure if it's not absorbing that, you're definitely looking into why that's the case.
Right.
But then also, if you're not absorbing, making sure that we can get you into a good process or a place in regards to building that level back up again.
Yeah, very good. Okay. What's next?
Okay. All right. And then we also look at thyroid levels. There's 3 different thyroid levels that we look at. There's a TSH level, which is a hormone that your brain makes, and it sends to your thyroid gland to tell your thyroid gland to make thyroid hormone. And then there's a free T3 and a free T4. The free T3 is the active form that your body uses, and the free T4 is the thyroid hormone that your body makes to kind of have on hand. So as you need it, you convert it. And so we look at that whole process. Now that's important because it also relates to weight loss and weight gain. It can be a stressor. It can be directly related to the other hormones that we look at as well. And it's kind of a whole process and circle that your body is always trying to balance out in order to get you through daily life. It does help with brain function as well. So that brain fog, the thyroid is definitely a big portion of that.
Yeah.
Energy, metabolism, and weight maintenance as well. So your levels, starting with the TSH, was looking good, a little bit on the lower end. It was 1.8. The range is 0.5 to 5.3. And then the active form of the thyroid hormone, that T3, that was a little bit on, we'll say, the low side. It was borderline for the range. It was 2.5, and the range is 2.5 to 3.9. So lower than what we'd like to see it. And then that T4, which is the inactive form, that was at 0.87, and that range is 0.61 to 1.44. So that was towards the lower end of the range. And then the active form your body needs in order to get through daily life was borderline low and out of range. So that's something that we were looking at to recommend in regards to building back up for you.
Yeah, so you prescribed a med that is a derivative of a pig.
It is what they call porcine derivative. Yes, it's a
It's so much nicer to say it like that. It's a porcine derivative.
Porcine derivative, yes. Try and
It's
start
from a
out
pig.
saying it that way. Or from pig, yes, correct.
And I'm hoping and confident that my my level will improve more into the mid-range or maybe even optimal. I may have misspoken earlier. I said 6 months, I think, for my next test, but I'm seeing now in my notes that the next test should be 6 weeks.
Correct. So with a lot of the hormones specifically, it takes about a week or two to start building up in your system,
Okay.
3 to 4 weeks to start kind of averaging out and plateauing. And so by week 5 and 6 is usually where they're going to be on the dose that you're on. So we like to check it around 6 weeks, 6 to 7 weeks. To see how well you're doing, how the levels are increasing. Everyone absorbs differently. So we like to just kind of touch back a little bit sooner rather than later when you're starting up so that we can get you on the right track and get you to a cruising mode.
Love it. Anything else in my report that we should talk about today?
So the testosterone is definitely something that we like to track for sure. It's one of the main hormones. Most people are familiar with it. And the level for your testosterone, let's see here, was 230. Sorry, I want to kind of let you know that sometimes the ranges are a little bit different from lab to lab. So you might have 2.3. Most people know it as 230. And the range is 175 to 780. Nationwide, that range can average up to 1100 as well. So it depends on what machine, what processing they use, but that would be the average. So yours was on the lower end of that range. And circling back to that optimization, lower end of the range, if you were used to living on the higher end of the range, so you were used to living at 600, then that difference is a big change for your body.
The testosterone is particularly intriguing to me because, true confession, and you know this, I was taking testosterone, applying, I should say, testosterone before you and I connected. And then what we're trying as a simple bump is just applying it twice a day instead of once a day. And by the way, guys, this is a what do you call it? A compounded pharmacy.
It's a compounded pharmacy. So they take basically the micronized powdered form and they place it into a cream so that you can apply it and absorb.
Yeah. And you want to put it on somewhere where you have thin skin so it can be absorbed. It's the easiest thing in the world. It's not probably before you go to bed. It's not something you want to wear around all day. I don't think. I don't. But that everybody can make their own decisions about it. The important thing is to find out where you're at first, then get that zing back in your step if you can. Let's talk about the remaining tests. I think we have about 3 left.
Okay. The next one that we tested for you was the Prenenolone. And the Prenenolone is important because it's actually, we'll say, the parent hormone of all the other ones. So Prenenolone actually converts to all the other hormones that we've been talking about, with the exception of the thyroid.
I didn't even know about it.
And most people don't know about it, correct? But it is important because most patients come in with symptoms of low Prenenolone. but they
Wow.
didn't know to ask about it. So the pregnenolone it actually works in the cognitive portion of the brain. So that brain fog that we all think about that's related to age, that's actually can be related to pregnenolone. It helps with memory, focus, concentration. It also helps increase energy too. The interesting thing is that there's studies that are coming out now that are actually linking pregnenolone to dementia and Alzheimer. So those patients have low pregnenolone levels. So there seems to be an indirect, at least, correlation between having a low level, seeing that brain fog or experiencing that brain fog, in potentially having that lead to Alzheimer and dementia at this
Wow.
point.
And we know Alzheimer's and dementia is up as well.
Correct,
And you're
correct.
seeing that most patients are deficient in pregnenolone.
Most patients are. The majority of the patients we check are at least on the low end, if not low. Yours came in at less than 10, and we want that to be, it can be up to 150. So we were definitely on the low side, and that is definitely something that we're going to recommend for you.
You're lucky I don't doze off during this podcast, man.
I promise there won't be a test on what you remember at the end.
Well, pregnenolone really got my attention because I'd never heard of it. I've heard of testosterone, I've heard of cholesterol, I've heard of vitamin D. This was a new one on me.
Mhm.
And I'm just encouraging everybody to get themselves checked and learn more about your own damn body because nobody else is going to take care of you. You have to take care of yourself. What else you got?
We also have DHEA, which is a similar hormone to testosterone, but once again, not patients usually aren't as familiar with. The DHEA actually converts to testosterone, so it's very well linked with it in regards to what it can help with. Your level was 82. The range we have is 34 to 568. So that was something that we were going to work on as well. So not only does it help with symptoms that testosterone does with energy and stamina, but it also helps boost the immune system. It also has some anti-inflammatory effects. It helps combat stress in the body. It also helps us with weight maintenance. It works on some pain receptors. So those generalized aches and pains that we start to experience, it can actually help with that as well. So it
Yeah.
does a lot of different things
Yeah,
for
you
us.
even mentioned when we talked the first time, skin integrity, whatever that is, but it sounds good.
Skin integrity is a
Who
word that we
doesn't,
kind of use to combine
who doesn't
a
want skin integrity? Come on.
skin integrity. So that actually is a just an overall phrase for that papery thin skin that we start to see as we age, how it's not as it tends to be more wrinkled, tends to tear easily. Basically, that's helping like an anti-aging for the
Yeah.
skin,
And this is
essentially.
called DHEA, everybody. It's an abbreviation of this fantastic triple word score in Scrabble. I've seen this name a million times. I can't pronounce it. What is the correct pronunciation? Do you know?
The correct pronunciation, I have to look at it in order to pronounce it as well.
Yeah.
Dehydro. Now you got me on the spot.
It's not easy.
No, it's not. Dehydroepiandrosterone.
Yeah.
Sorry.
That's why we call it
That's why
DHEA.
we call it DHEA.
And
Yes.
once you know the acronym, you never have to say the other one, so you're excused.
And I'm probably going to check my Prenenolone after this as well.
Touche. What else? Anything else?
Let's see. Those were the main hormones. For males, we also do check estrogen. Testosterone can convert to estrogen. So anyone that's on testosterone therapy, we at least get a baseline and continue to monitor. Your level was actually looking good. It was at 27, and we want that less than 40. So it's just something that we continue to monitor. We wouldn't necessarily supplement.
A lot of
And
people
then we do.
know, Sarah, that men have both testosterone and estrogen, and women have testosterone.
Men do have estrogen and testosterone. Women do have estrogen and testosterone as well. And actually, they have more testosterone than estrogen. But most patients don't realize that as well.
I didn't know that.
Yes, yes, they do. So everyone has a little bit of everything, at least.
All right.
It's just in different balances that make us a little different.
Excellent. I'm so glad we're talking today. And then last but not least, cholesterol. And thankfully, mine was fine. I've never had an issue with cholesterol. I'm lucky, I guess, in that respect, or maybe part skillful because I'm careful about what I eat. But this is a huge problem for a lot of people, and it's a killer because cholesterol, as I understand it, is like it's the muck that plugs up the plumbing.
Correct.
And once it starts to do that, it's hard to keep it down.
Correct. And so we use that as a screening too, just to make sure that everything is in place in regards to the hormones. Most patients also don't realize that we actually take the cholesterol and turn that into these hormones that we've been talking about, the estrogen, testosterone, prenenolone. Prenenolone is actually the first step. So we need to have some cholesterol in the body, but obviously you want to make sure that it's not going over the amount that we need to cause some
Right.
of these other issues like heart disease.
I'll tell you what, man, this was such an eye opener for me, and I'm so glad you agreed to talk about it on the podcast so that hopefully we can help some other people. Before we close, let's talk about some of the downsides to HRT. And there are a few, I guess, depending on who you talk to. The one that almost everybody agrees on is it's expensive. Most of these HRT or hormone replacement therapies are not covered by insurance. They're a lot easier to get prescribed than they used to be, and they're a lot more dependable in terms of treatment.
Mhm.
But did you tell me that California, like everything, it's starting on the West Coast and it's probably going to proceed? Legislation is nowhere caught up with this yet.
Legislation is nowhere near caught up with it by any means. And in most of the states, or I'm going to say the majority of the states, it is not covered through insurance. Um, it, but as you said, California is starting that trend, just like they usually do, and trying to take a step in the right direction and making sure that this particular health and wellness, the sexual hormones that we're talking about, is such a big part of patients' lives that they are starting to cover it. I believe there's actually statistics out there that say even for women, 85% women report that they have a decrease in productivity in the workplace because of change in hormones. So there's, with more studies coming out, more knowledge, that is coming out through these studies, it's such a big part of daily life that we're starting to see legislation and, more access to them, for
So what
sure.
Sarah and I are getting at in our own way, everybody, is this is going to be like anything else, any other living expense that you have. It's a trade-off. You can keep the ESPN subscription, or you can feel better every day. And in the case of cognitive decline at work, you can get a promotion uh, because you're not slipping. So there are serious advantages to looking into this and working with it. I had a question for you I haven't posed in our previous conversation, Sarah. Is there a danger? Well, let me ask you this 30,000-foot question first. Uh, is HRT safe?
So that is probably about 100 questions in one, for sure. So we are learning more and more each day. And in regards to safe, it depends on the quality of care that you're getting, the quality of the product that you're getting, how well you're being monitored, and how well you're taking all of those pieces and applying them to your situation. So you want to make sure you are getting your prescriptions from someone that has experience in dosing hormones. And the reason why I say this is because you want to make sure that you know where your levels are and where they're going. And if you're going to be putting effort, and financially putting, towards something that is helping you, you want to make sure that you're seeing those results. You want to make sure that it's happening in a balanced way. Just because we have a range, we don't want to go way over that range because it can cause other symptoms as well. So there's multiple different facets to your question.
Yeah,
Hopefully I'm starting to answer some of them.
you are.
um,
And of course, we said at the beginning, you want to do your own research, everybody. You want to talk to your doc or trusted doc, or a team of doctors, if that's the case for you. You want to do your own reading and read from good websites, good sources. Um, do you have a favorite website that you would send people to for general information about health?
general information about health. Typically, most clients or patients we would refer to National Institute of Health.
Okay.
You will see a lot of information, including hormones as well, and what they were, what they're linked to. They do and can assist with a lot of illnesses that we see out there. And to kind of also summarize the question that you just previously asked, you want to make sure that it's right for you, and that you're, doing it for the right reasons and being monitored.
Yeah.
So hormones can help with osteopenia, osteoporosis, as we mentioned, Alzheimer, dementia. It can reduce cardiovascular disease, especially for women after menopause. And so there's a lot of benefits to them. But we want to make sure that it's being monitored and you're getting the correct dosing as well.
I just finished not too long ago Peter Attia's new book on longevity. I can't actually remember the name. Live Longer or something? Do you know the book?
I'm familiar with it. I can't say that
It
I've
won't
read
be
it,
hard for
but
people to
familiar with it.
find. Peter Attia, he's an MD, Attia. Um, and he talks about a lot of this stuff. He's also got a terrific podcast if you're looking for resources. So kind of a futuristic question to wrap up, if you don't mind, Sarah. And the question is this, I've been thinking about this a little bit. What happens to people who are living younger as they age? Is there a danger to this? What happens when you have the body and the hormone levels of a 25-year-old, but you're 95? Because technically you could keep your levels elevated well into old age.
Mhm.
Is there any downside to that?
So statistically, I can't necessarily speak to that because we don't have those studies that um, that coordinate everything that you specifically just asked.
Because we haven't
But
been
I
doing
can,
it that long.
because we haven't been doing it that long, and there just isn't that time frame that technically you're asking about.
Right.
However, this is, as you said, a fairly new medicine that we've just started learning about. We didn't used to live to our 80s and 90s before. We would live to our 40s and 50s, and that was it. And this is basically the average, years of menopause.
Yeah.
So there wasn't a need because we weren't living long enough. So now that we're living past that point, now we're trying to catch up with that science and technology to say, okay, now we know this is linked to other illnesses. We're trying to prevent these other illnesses. We're living longer, and we're seeing that our body's not producing as much. So the real question is what can we prevent and help us establish that healthy life as we live past those 40s and 50s now, and still have that quality of life to continue into our 70s and 80s and 90s like we
Yeah.
are. And go ahead.
Well said. The Attia book is Outlive: The Science and Art of Longevity. And one of the things he put forth in the book was that, if we all are going to die someday, and the question, the base question for all of us is, what's the better way to go? A long, slow decline, or live a healthy, happy life until it's your time, and then, it's over in a couple of days. I mean, I don't like to think about either of them, but I like to think about one of those more than the other one. And
Correct.
this is what we're trying to convey to everybody today, that when you take care of yourself, you're going to have that longer, healthier time on planet Earth. Sarah Markiewicz, you are becoming a physician's associate.
Yes.
And you
Yes.
can be found at the Proactive IV in Rochester, Michigan. And you guys are providing prescription and test results to people who are not in our area. You can do this for anybody, right?
We do, yes. So we are opening up to telehealth. We still have some stipulations in regards to which states,
Yes.
but you can definitely contact us and we'd be able to walk you through that.
So translated, everybody, you'd get in touch with Sarah and probably do a Zoom call just like this. You'd get your test results. You'd get a prescription. They may want you to purchase some kind of a plan. Who knows how that works? But Then this compounded pharmacy would put it together and then ship you your stuff. Don't leave it on the porch for 3 days during the summer. Get it in your body, and start living a better life. Sarah, you're so impressive. I'm so glad we're connected, and thank you very much. Let's take a look at my test results when they come in. We'll do another quick summary for everybody.
That sounds great. I'd love to show them how well they've all improved.
Sarah Markiewicz at Proactive IV in Rochester, Michigan, everybody. Thank you, Sarah.
Thank you.